Hello, you guys. For this skill, we're going to focus on feeding the resident. Now, this skill should go fairly quickly and it doesn't require much instruction. All we're going to simply do in this procedure is the same thing that you've been doing in clinicals. We're going to feed the resident. However, I'm going to show you the way that Headmaster wants you to perform this skill and the way that you should perform this skill. First thing I'm going to do is I'm going to gather my equipment and show you guys what is required of this skill. So with this skill, there is a part in which there will be a little bit of recording that'll be needed. Again, as I mentioned to you as from the first day, feeding is the only skill in which we do not need privacy. So don't be alarmed if I don't say privacy. You're going to need a clothing protector, which can be used as your towel. You're going to need wipes because you're going to need to wipe that person's hands. Now, your book does say you can use soap and water, but we're going to use hand wipes in this case. And you'll also need your tray. Now, your tray, the contents on that tray may vary a little bit. These here signify that it's an assistive device. That's why that is on there. But don't worry and don't get caught up about what is on the tray as far as what is on there to eat and all that. Now, one thing, your tray should include a meal ticket. This is just a sample meal ticket here. Meal tickets, as you see and pay attention to in clinical, meal tickets will list that person's name. It'll list the type of diet that they're on, any supplementations that they're getting, and the consistency of those things. So your job as the nurse aide is to make sure that everything matches up with the meal ticket. A lot of facilities generally have armbands for the patient. Your skill specifically states that we never suggest the person's name to them, because if I am that demented resident and you ask me if my name is Mary, I may say yes. You ask that person to state their name, to tell you their name simply. Now, as I said before, most facilities do have armband. Some places do not. If that is the case, please feel free, if you're not familiar with that resident, ask the nurse, or better yet, check the chart. The chart simply will have a face picture or a headshot of that person. You want to make sure that you're feeding the right patient, because if I am a patient who has had a stroke and you feed me a regular diet, I have a higher chance for choking and aspirating. So make sure that you review those things. So to start with, of course, yes, you're asking, do we need gloves for this skill? You do not need gloves for this skill. Now, you notice that in clinicals that when we feed those residents, have you ever seen anyone with gloves on? If that person is on a special precaution or isolation precaution where they have some type of infection or they're sick with a virus or an illness, then 9 times out of 10, that person will eat not in the cafeteria, but they'll be in their room to have lunch, dinner, or breakfast. So please be advised with that. And of course, there we want to use all of our PPE. I'm not saying don't use your PPE if they're on isolation and we're feeding. Yes, use your personal protective equipment. So for this skill, we'll run it from the top. But as I mentioned to you before, you'll have a meal. You'll need your wipes, and you'll also need your clothing protector for this skill. Your liquids will already be supplied to you. On skill day, yes, you may have to very well pay attention to the fact of that you're going to have to feed that person. You're going to feed the person who's going to be your patient. So you want to make sure that you're paying attention to what's going on. Okay, so here's my tray. We're going from the top, if that's okay. Hello, Mr. Jones. This is Doris. It's breakfast time. I'm going to get ready to set your tray up this beautiful morning, if that's okay with you. Okay, wonderful. Okay, I'm going to lift the head of your bed up because I want to make sure you're sitting straight up, as tall as a tree, because I don't want you to choke. And I'll go ahead and take the cobweb away from you as well right now, so that we can go ahead and have that old thing out of the way. I'm going to sanitize my hands too, because I want to make sure that my hands and your hands are clean. So the first thing I'm going to do is I'm going to go ahead and I'm going to sanitize my hands. Okay. I'm going to go ahead and apply my drape though. Let's go ahead and get that out of the way. I'm going to place this over you. Okay. We never refer to this as a bill because that can be offensive to that person. Okay. I'm going to go ahead and I'm going to use my wipe. Okay. And I'm going to wipe his hands for him. So I'm going to pretend I have a wipe. All right, Mr. Jones, I'm going to wipe your hands off. Now, your observer is going to want to see you actually wipe the person's hands. So with your wipe, you'll wipe. You want to make sure you're wiping all your fingers, front and back of the hand. Put their hand down, okay? You're going to do the same thing for this hand. Wipe it, clean it as much as you can. There. The reason being is because sometimes some residents, they like to assist us in feeding them. So that's why that's important. You'll take the wipe and simply throw it in the trash can. They're going to want to see you throw it away. We're going to place this here. Next, I can go ahead and pull my table. Now, with this skill, it's very important for you to be in a position in which you can face your resident. You can lower the table as needed. Now, some people may prefer to stand, but I prefer to sit down if I'm truly demonstrating that I'm feeding a patient. Okay. Now, with this being said, the first thing that you do is you're going to want to check what's on your tray. You want to check it in comparison to this meal ticket. So we have Mr. Roger Jones, who's on a low sodium diet. For breakfast this morning, he has grits, he has eggs, he has toast, okay, and he has turkey bacon, okay. So I'm gonna go ahead and I'm gonna check. Yes, he has all those items that I said, okay. You're gonna also want to make sure that you're testing that. This is not required as a part of your skill, but check the temperature of that coffee if it is hot, just by placing your hand over it, because we don't want to give the person anything too hot. We don't want to cause a burn. The next thing that you're going to do is you're going to make sure you have plenty of liquid. Now, your book does suggest that you go ahead and make sure you offer sips of liquid in between bites of food. So, Mr. Jones, I'm going to go ahead and I'm going to get ready to feed you. What would you like to eat first? You have your grits, eggs, or would you like some of your turkey bacon? He wants grits. Simply put, I'm going to take my spoon and I'm going to feed it to him, just like you feed yourself, okay? We're going to get some eggs, and you have to do this slow. Do not come into this skill trying to feed that person fast. You want to make sure that they're chewing each bite and swallowing it, okay? After about the third bite, okay, you want to make sure that you're offering them sips of fluid. Mr. Jones, would you like a sip of fluid? Yes, he would like some. Simply put, I'm going to put it up and I'm going to assist him with drinking. Now, if he gets a spill on him, I simply take the towel and pat, 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 not rub, pat. Now, I can also better help Mr. Jones by saying, if he were to feed himself, Mr. Jones, at 12 o'clock is your grits, at 3 o'clock is your bacon. That helps our patient who may be visually impaired be able to know what they're getting ready to intake. Okay? All right. Another thing, I'm going to go ahead and I'm going to give him a little bit of his cereal. Give him a bite. Same thing as before. Give him a bite, and then at the end of that, you want to pat, 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 pat. Now, say Mr. Jones tells me that he's full, he's had enough. I have to look and know what my meal percentages are, and your book does speak about recording those meal percentages. So let's say for pretend, I know that he drank 360 milliliters, and he ate maybe 50% of his meal. So I'm going to cover this up, okay? I'm going to go ahead, Mr. Johnson, I'm going to remove that clothing protector off of you. I'm going to go ahead and take that to the dirty linen, okay? Be mindful of how you roll this up. We want to make sure we're rolling it up so that food contents don't come out, okay? I'm going to take his linen, and I'm going to also go ahead and take his tray and remove it. I'm going to place this tray there on the storage area, and I'm going to place my linen in the soiled linen hamper. I'm going to come back into the room. I'm going to go ahead and Mr. Jones, I'm going to wipe your hands one more time with my wipe. Take the wipe, and you want to wipe his hands one more time. And you may say, well, hey, he didn't use it. But you still want to show that to your RN test observer that you at least tried to make sure his hands were clean and you threw it away. Mr. Jones, I'm going to go ahead and cover you up, but I'm going to leave your head of the bed elevated because you just had a big need. Okay? Is there anything else I can do for you? Okay. I'm going to push this table back out of the way. I'm going to go ahead and I can take this now to my storage. Come back in for my final look. Everything's good. He's straight. I'm going to go ahead and sanitize my hands. I'm going to go over to my recording. And I'm going to simply record that he ate 50% and he drank 240 milliliters. At this point in the skill, I can say, sanitize one more time just to be on it. Skill complete.